How's it going? So after my upper thoracic mobilization video, which is really popular, a bunch of people asked, how do I get the same results myself? Because it's a great technique to be done to you, but you can't exactly do that upper thoracic mobilization yourself. So there are two ways. First, I want you to just sit up nice and tall or stand up nice and tall. Make sure your chest is elevated. If you do a chin tuck and retract, that's a common McKenzie exercise, but this doesn't feel very good because as you're trying to extend, your flexors are actually co-contracting to kind of prevent your head from falling backwards. But if you give yourself some light resistance, so just imagine pushing forward with your hands, fingertips right on the base of your skull, then all of a sudden, that if you overcome that light resistance with your neck extensors, you can go back a lot further. So this ends up being a great reset to hold this sustained for about 2 or 3 minutes, depending on how long you've been sitting and flexing and internally rotating. The second one would be a great chest opener. So if you put your hands, interclasp them, put them right at the back of the base of your skull, lightly push backward, but now you're gonna even that out with your hands. So it's gonna be an isometric neck contraction. You're gonna open up your elbows as far as you can. Now just extend as you're pushing back into your hands and make sure you're extending think about lifting your chest up a couple of inches. So this should be coming from your chest and not your low back. It shouldn't be low back arching. If you can't isolate that, you can always put your back up against a chair. So if you just do this repeatedly throughout the day, that is a great 20-20 rule or reset to do often throughout the day. Again, 20-20 rule would be every 20 minutes, do 20 seconds of something else. That really helps take a lot of tension and stretch out that difficult to stretch upper thoracic area. Okay, so first overcome, hold that sustained. That's a great shotgun technique for a lot of upper quarter tension, anything pain rating down all the way to the scapula, and this chest opener and upper thoracic self-mobilization every 20 minutes. Do that for 20 seconds. Let me know how it works out for you.